The question that comes back very often is, why do I have pain? Well, if we want to make it simple, let's say you have three ways to hurt yourself. One is illness. If you have a tumor in your back, you will have pain. That's very rare. Second possibility is you get an accident. Say you fall in the stairs. This is the quick way to hurt yourself. If you choose this way, say, solving the symptoms will be enough because the causes belong to the past. The third and most common way to hurt yourself is what we call overuse, cumulative disorders, or MSD, musculoskeletal disorders. And you see, the principle of musculoskeletal disorders, as they are cumulative issues, is that one, they are multifactorial, two, there's a time delay, i.e., there's nothing happening until the glass is full. And by the time the glass is full, you don't need much for triggering the pain. In the glass, you have three parameters. One is the faucet, what you do to your body throughout your daily activities. The other one is the straw. How do you manage to relax your tissues? And the third parameter is the size of the glass, which depends on your medical condition, your physical condition, and your psychological condition. These are the three factors, and you see, to make it very short, that basically you will have pain if you put through the tap more than you take out through the straw. In other words, if you use your body more than you rest it, it will hurt. The glass is your body as a whole. It can also be your elbow, your neck, depends on the clinical reasoning we're having. The strategy for solving the glass problem is 1, we close the tap. 2, we use the straw more, better. And 3, only 3, we will think of making the glass bigger. The reason for that is that making the glass bigger involves dangerous activities such as strength building, and we don't do complex things before we know how to do simple things. So if step 1 is to close the tap, you need to know what's behind the tap. Behind the tap, you have the 24/7 combination every second of 4 factors. What you do, in which posture, for how long, in which psychological state. Let me take them in a split order. In the psychological state, which is shortened under stress, you have 2 things. You have stressful situations and you have the way you look at them. This is called personality factors. The basic rule on stress is the less stressed you are, the better. I deal more with biomechanics. Biomechanics is posture, activity, duration. What I call posture is everything that you do, consciously or not, willingly or not, with every muscle and joint of your body. This is why you will never hear me speak about a perfect posture, because there's an unconscious dimension in that. We will talk about improving your posture, improving it until we get a better balance between the tap and the straw. Then we have activity. What makes an activity intrinsically dangerous is 3 things. Is it heavy? Is it in a cold environment? Are there vibrations or shocks? And in duration, I put everything which you could express in terms of time. So it's more the way you use the time. It's duration of exposure in seconds, minutes, years. So how long have you been sitting today? At which age did you get your smartphone, etc. And then it's also speed and frequency. Yeah? If you do a quick movement, it's more risky on your joints than if you do the same slow controlled movement. Let's go to the basic rule of biomechanics. The basic rule of biomechanics is that you may only take 1 risk at a time. You may sit in the wrong posture, no problem, but not for too long and not whilst doing something dangerous, such as being in a car that has no suspension, for example. That would be shocks or vibrations. What we have as a combination in most office workers is bad posture combined with prolonged duration. And you see with this picture, that's why I'm not too much of a fan of the advice which says, well, move and you'll be better. Because if movement quality is bad, moving a lot does not resolve the problem. Think of cleaning ladies, for example. Things like this. In a lot of professions, move a lot. Are they in a better health than office workers? Of course not. Because you can move a lot and throughout all your daily activities still damage the same part of your body. So, movement is important. You'll never hear me say that movement is not important. But somehow, if you don't work on quality first, You should not focus on quantity. You see, we all have complex lives, and therefore the 24/7 integration of posture activity duration stress is a complex thing. But we have patterns. We know that office workers, for example, are rather going to sit a lot. We know that paramedics are going to lift a lot. We know that childcare workers are going to bend down a lot. And this gives us entrance points to kind of start the re-education process, start reconnecting you to how your body works, how you feel it, and improving your gestures. And thereby, we will little by little close the tap once we teach you how to better relax your body, that is the straw, and little by little we'll rebalance the two until the glass stops overflowing. And all that is there for actually coaching. So it can be done at a distance. This is the point of the 10 weeks online back saving program, is you do the job and I guide you throughout the process.